My name is Greta Sheehan, and this is my Nursing Skills 312 Central Line Dressing Change. So first I'm going to perform hand hygiene, and I have looked in the patient's chart to see that they are due for a central line dressing change because it has been 7 days. I've checked the patient's MAR, and I have noted that they have no known allergies, and I've done my first check for both the sodium chloride and for the heparin. So I'm going to gather my supplies.
Come in.
Hi, my name is Greta. I will be your nursing student today. Can you tell me your name and your date of birth?
My name is COPD 212XX.
Okay, COPD, I'm just gonna scan your wristband and then I'm gonna pull up your chart. Okay, so I see COPD 212XX. It says no known allergies here, is that correct?
That's right.
Okay, and no allergies specifically to any antiseptics such as chlorhexidine or any tape or adhesives?
No.
Okay, great. So today we are going to be doing a central line dressing change because it has been 7 days since your last dressing change. Are you aware of that?
Yeah, the nurse mentioned earlier that you'd come around.
Yes, so your central line is that direct access to your blood vessels right by your heart, and so we're going to be cleaning this area today to ensure that there isn't any bacteria there, and we also want to prevent that spread of infection. And so I'm going to be assessing your site for any pain or tenderness or any signs of infection, and then we'll be doing an aseptic technique of applying a new dressing. If I have a mask for you, would you be able to wear that today?
Yep, that's fine.
Okay, if the patient would be unable to wear that, I could have them turn their head away. But since they are compliant, we will be going with that. So now I'm just going to be doing my second and third check for these sodium chloride, flush, and heparin. The sodium chloride is to ensure that your central lines are patent and clear, and your heparin is a preventative prophylaxis to prevent any sort of clots, okay? Do you have any questions with that?
Not right now.
Okay, I'm doing my second and third check. And my third check. Okay, so now that I have done my checks, I'm going to be setting up my sterile field. Here is your mask. And for the purposes of this video demonstration, my mask is here, but I'm just going to be putting it to the side. I would wear my mask, but just so you can hear me. So I'm going to be setting up the sterile field. Ensure to only touch that 1-inch margin. And I cleaned my hands, but I can always clean them again. And so now I'm going to be putting my supplies in here. Okay, so now I'm going to be putting on gloves and assessing the patient's site for any signs of infection. And it's important to also note that I have my working triangle here for efficient and effective work. And so now first what I'm going to be doing is making sure that all the lumen are clamped, and this is to prevent any spread of infection. So I see here that they are all clamped. And so now I am just going to ask, do you have any pain or tenderness as I palpate here?
No, it feels good.
Okay. And so I'm just going to be working to take this off distally to proximally in order to just prevent that risk of infection. And so I'm also going to be sure to stabilize the catheter, and I will be measuring the catheter later to ensure that it has correct placement. If there was incorrect placement, the numbers were different, I would contact the physician and notify him of that because it could be displaced. Okay, and now I'm removing the chlorhexidine patch, and I am taking off my gloves, washing my hands, and then I'm going to be putting on my sterile gloves. Get 2, just in case. Hands are a little slippery due to the alcohol, but we will work. Okay. Being careful to only touch the 1-inch margin. How you doing, COPD?
I'm doing good.
Good. Okay. Make sure to. There we go. Okay. So now that I have my sterile gloves on, I'm going to be cleaning this site, and I'm going to be using the gauze to stabilize this. So I am going side to side, up and down, including cleaning the catheter. And I'm also going side to side. I'm going to do this for 30 seconds. 30 seconds is up. I would make sure and not blow on it, but wait for it to dry. And also I would clip these wings too. So then I will throw those away. And now that I have allowed the site to dry, I'm going to be putting on the chlorhexidine patch. Maintaining. So now technically, since my right hand has touched the patient, it is no longer sterile, and so I am going to be making sure to only touch the tegaderm with my left hand. So then I'm going to be centering this, pressing down. It's important to put my name, my date, or my initials, the date and time, so that the next nurse can know when 7 days are up that it is time for dressing change. Okay. I decided to stay on there. Okay, so now that I've done that, I am going to be measuring the site. As I mentioned earlier, we want to make sure that this is the same distance, and so I'm going to be going from the site of the catheter and measuring to the white lumen as specified in the chart, and it is 13, which that was the same as the previous reading, and so I'm not concerned. If it was a different reading, I would be sure to document that. I will document it anyways, but I'll be sure to notify the physician if there would be any problems with that. So now I'm going to be labeling it with the time. I could just do this not on the patient. and my initials, I would do that over here. And so now that I've done that, I'm going to prepare to flush the site. And so I'm going to be choosing to do the white tubing for the central line. And so we're also going to be changing out the tubing here, and so I want to do that aseptically. So I have done my previous 3 checks on this, and I will take this off. And I've got I'm gonna open it here. And then I'm going to prime it. Put it on here. Okay. And so now that I have that primed, I'm going to carefully take this off. Ensure aseptic technique with that. And I'm going to take this off. And this is clamped right now because this needs to remain clamped because it's going to be open to air. And if there was any gunk or anything that needed cleaning, I could always use a chlorhexidine wipe. But for this, it is clean and patent. So no concerns with that. And then I'm going to open the cap, and I'm going to be pulling back to make sure that I have blood return, and I do in fact have blood return. This is important to ensure that the site is patent, and if I couldn't get a blood return, I could either have the patient change positions, perform the Valsalva technique, I could have them cough, and so there's multiple different techniques, but we had blood return, so we can administer the 5 milliliters as prescribed in the MAR. And I'm also feeling to make sure, is there any difficulty as I'm pushing this flush? So then I'm also going to be doing heparin. Ensure to prime that. And I'm going to be doing both of these over a minute. And so the first one I did over a minute, and this one will also be doing over a minute, but for the purposes of this procedure and the time, I'm just going to be pushing. Okay. So now that I've done that, I am going to make sure that the site is clamped. And do you have any pain at all?
No, I feel good.
As I was, okay, doing that, perfect. And so now I'm just going to be cleaning up, and then we'll be good to go. Do you have any questions for me at all?
No, I don't think so.
Okay, I'm going to be sure to document that the procedure was done, and also the length that I mentioned for the lumen, and then I have provided the colite, and I'm going to remove privacy and foam, and also I'm going to be removing this for him, and then I will foam out.